So today I'm going to talk about a case because I've spoken before about patients that I've had where the bones got better since I treated them. And the methods that I use are very good for the jaw joints. That's why they get well. But this patient came to me through the internet. Thank you, Sean. You're not here today, but she found us and we took care of her problem because she knew she had a bite problem. And this is how she looked when she started. She had facial asymmetry. If you look at the way her jaw goes in there, muscles go in. But I'm going to digress now. Well, just go through it because we have only so much time. But this shows her jaw bones when we started, and as we move along, we're going to show how we did the study model. This is how I treat all of my TMJ patients. And I was telling John Alban, this is a presentation that I give to all of my TMJ patients before I start them. So this is all technical, but I show them how we're going to fix their bite, how they're having problems. And I also show them a movie
This is what happens every time Liliana bites. The teeth hit, they slide forward, the jaw displaces.
That's why she hurt, because her jaw is displacing.
Teeth hit, the jaw slides forward.
Supposed to do it. You're supposed to stay still. And then it shows the jaw displacing. Okay.
That's why your bite is so uncomfortable.
That's why she's so uncomfortable life. Okay, now we fixed her and did everything we said we were going to do. And she moved away to upstate New York. And she came back because she wanted to get another adjustment. So the reason you see these, this note right here is I made copies of this presentation, and this is from Don Sharda's advice to, if I send it to someone, another dentist, they have to know that the use of the material that I've created is strictly to help the patient and can't be used in any other way without my permission. So.
How many is it for somebody else? On YouTube?
Well, I'm just going to advance on my hand. My remote. On my computer, does that anything else? There we go. There we go. I don't know what happened. But she came back and we took new photographs of her face. And then if you compare the photographs, if you look at how her face right here is kind of hollow looking and filled out now because she's healed. And the whole width of her face is different and her neck looks different. but mainly she's comfortable. And then this shows how I made her bite even. And a lot of dentists don't understand that. It's technical. So we're going to fast. I mean, a lot of patients don't understand. We're going to fast forward to the. Okay, so we took new X-rays of the jaw joints, and this is kind of difficult for you to understand, but the bottom line is the bone field that actually grew wider. And we're talking about bone density and how the joint changes. And so if you look at one versus the other, these images are 1-to-1, and that's the good part. So this image and this image, where's Mike? Mike, you like this? Dr. Valentine, the bone is actually healed, and when you see that white, and it's not white there, it's white means the bone is denser because it's being pounded, but this is how a more normal bone should look. And the other item is, one of the other items is the thickness of the bone right actually got thicker, which means it got stronger and it's healed. And the other thing is, if you look at the shape of the bone here, this is the base of the skull, where the jaw pushes in and touches the joint. The actual base of the skull has changed for the better and has more of a normal shape. And I think, well, this we talk more about it, but I think that's enough for if you're not a dentist. That's enough, but I think if you're a patient, you actually see your bones getting better. So I have 2 minutes. Yeah, that's what my wife says to me. Yes. Okay. Question. All right. Questions now.
Two questions.
Two questions.
If you sleep on your side, will your jaw displace? Number
Yes.
one. Number two,
Yes.
is this more cosmetic or will insurance pay for it?
Oh no, insurance pays for it. Oh yeah. That's a good question. Then I'll go back. Now we'll go back.
Medical or dental?
This will be good. This is good. And this is an excellent question because I thought maybe I didn't have time, and since I asked, part of the treatment is you have to teach the patient not to sleep on their face, on the stomach, I mean, because you twist your head all night. If you sleep on your side, you need a big pillow to keep your neck straight. So look at her spine. Look at her spine. She had scoliosis. And now look, it's straight. And part of that was I had her sleeping in a different position. So if you look at the two, it's quite different. So it's all inclusive. If you had back problems, it's going to displace your jaw. So if you don't take care of your back problems, you're going to have recurring jaw problems, because when your back twists, your jaw will go out of alignment and you'll have discomfort. So that's a big plug for chiropractors.
Is it medical or dental insurance that covers?
Medical insurance covers part of this, dental part of it. But we have a software in our office where medical insurance will pay. So we took a while. It took my front office gal 3 months to study it. But we now get medical insurance to help pay part of the TMJ. I think that's pretty remarkable. Thank you for your time.
I'm here to introduce a person. He says he loves cats. He says that he loves the sound when he hit the wall and they crunch. He does this right before breakfast. He loves to have coffee.